when lay people talk about anxiety, it's stuff that is a natural response. It's a survival response. Okay. If you're in front of a tiger, you'll feel anxious. That's a normal reaction that your body is designed for. Abnormal anxiety, to use a very, I mean, I'm dumbing this down, but abnormal anxiety is when you feel anxious even when there is no tiger in front of you. And there's no reason for you to be feeling anxious. And that's a very simplistic way of looking at it. But that's what, so clinicians, when they say anxiety, they actually mean abnormal stuff. I think the general population, when they mean anxiety, mean the normal stuff. So, if I'm feeling anxious about the fact that I might get COVID, that's a reasonable anxiety to have at this point in time. It's only if that anxiety gets to a point where it stops me from functioning or makes my life so miserable that I can't do anything, then you could say that, yeah, that's become abnormal in some sort of way. So I think it's very important to distinguish between what people call anxiety and what the clinicians call anxiety.
So let's
I
talk
don't know
about,
if that's a question.
yeah, no, that really helps as a starting point. If we talk about what people are calling anxiety, as you said, right now during this pandemic, it's normal to be anxious or to worry.
Yeah.
There is this whole, we've been hearing about this uptick in stress and anxiety, and I suppose fear as well, right? Not technical
Yeah.
terms. Are you
Yeah.
seeing in practice as well that more people are noticing that they're anxious and leaving the disorder aside for a moment? Do you think there's an uptick in?
Oh, I mean, that I think is quite obvious, even not just in practice, but even in general conversation with people. You realize that people are anxious. There are many things to be anxious about, and a lot of the anxiety is actually because of uncertainty. People are uncertain whether their jobs will survive or not survive, and that creates anxiety. Any uncertainty for human beings does create anxiety. So, I don't know whether my job is going to be there in 3 months' time, not be there in 3 months' time. I have loans to pay. I have kids to put through school. It's quite understandable that you would then have job anxiety, financial anxiety. If you're a young person at college, you don't know whether your college is going to restart or not restart. When is it going to restart? How is it going to interfere with your education? And that can reasonably cause anxiety. I mean, I think if you ask anybody, there would be reasonable grounds why almost every individual would have reasons for anxiety. It's health-related anxiety, it's education-related anxiety, it's probably even just broadly a future-related anxiety. What's going to happen to the world are worries that people will have. So you do see a lot more anxiety. I have no doubt about that. And the problem with anxiety is that we are all designed for dealing with anxiety as a short burst. So, using the tiger example, you are used to dealing with having seen a tiger and run away from there, the fight or flight response that is there, and then that ends. But if the tiger is staring at you every minute, all the time, then our bodies are not designed to deal, or minds are not designed to deal with that kind of, oh my God, the tiger is in front of me all the time. Uh, and so I think what happens really is that if you have even normal anxiety which goes on for too long, then that can lead to both physical as well as mental health problems. I mean, physical problems obviously, and mental problems too. So it's not that people are not anxious. I think the real issue is that how long is this anxiety going to go on? And we all have different levels of resilience. We all can cope with stress, if I can use it in a very, very broad sense of the term. We can all cope with stress to varying amounts. And when our limits are reached, then that pushes us into some form of illness, either physical or mental. So yeah, I think the anxiety going on for long is probably what is the worry.
And so, what would you say to someone who says, and obviously this has to be, it's quite generalized, so as much nuances you want to put in. Somebody who worries that they or someone in their family is anxious. You said, it's a cause for concern when it's kind of impeding your day to day. It's very extreme.
That's right.
But what would your advice be to someone right now, suppose in the middle of the pandemic, where everything is kind of virtual anyway, right? There's all the sort
Yeah.
of physical.
I think one of the best ways to reduce anxiety, if you're talking population level rather than individual person level. I think one of the best ways to reduce anxiety for many people is going to be just reduce uncertainty. If we can reduce uncertainty, then that will reduce anxiety. So, for example, advice to employers would be, why don't you reduce uncertainty for your employees? And while you may not have definitive answers, there's a lot of uncertainty that can be reduced. You can tell your employees that, look, this is where we are at, this is what is going to happen in 3 months. We don't know anything beyond 3 months, but if XYZ happens after 3 months, then ABC will happen to people. Some kind of a metric that people can then use, and it gives you a sense of control over the situation. You have some degree of certainty. Or in the education space, for example, if the government was to provide some certainties, like saying, okay, no exams this year till December. Now that's a certain degree of certainty. Once you have that certainty, you tend to relax to some extent, because you know that, okay, nothing is going to happen to that point in time. Even if it is not a great result, you at least know there's certainty. So I think one of the broadest things that we can do is to try and ask ourselves, how can we reduce uncertainty? What are the certainties that we can bring about? And that helps to control, or at least keep your anxiety under control. So that's the broad advice to everybody. I mean that, and now I know people will say, but a lot of these uncertainties are not in my hand. What am I going to do about it? In which case, actually, then it's a good idea to ask yourself, okay, which of these things that are worrying me are things under my control, which are not under my control, and the things that are under my control, what am I going to do about it so that it reduces my anxiety? So, take the example of a student. I don't know when exams will happen. I don't know when something will happen. Well, the easiest thing maybe to tell yourself is, okay, even if exams are happening this year, I'm just taking a break. I'm going to tell myself I'm taking a gap year, and that's completely fine. I don't have to worry for 12 months. I'll worry about next year. I'll start my education again like it is 1 year, a gap year. And that helps you to have certainty, even if you don't have control over what is not in your control. So I think people need to do those kind of certainties. I think certainties help to reduce anxiety. uh, that's a very, very broad thing. I mean, I know there are other stuff like, oh, why don't you do some meditation and do some pranayam and do exercise? Of course, those are things that help you to control your anxiety, but fundamentally a lot of the anxiety arises out of uncertainty. So try and get over the uncertainty is probably what you want to do.
And where would you, I mean, obviously you were diagnosed in a certain way. Where would you be concerned that someone should come in, or at least even virtually talk to a therapist or a psychiatrist for a diagnosis that it might be an anxiety disorder? Where does that line sort of get crossed?
That's a simple thing. Imagine if it starts interfering with your bodily functions, for example. What I mean by bodily functions, as in you're not able to sleep well, you're not able to. You get up in the morning, you're tired, you're not able to concentrate on anything, you're not able to do your day-to-day activities. You have distress to the level where the distress becomes disabling now. You can't get your mind off it at all. Uh, or let's say you lose your appetite, for example, you're not eating, you're losing weight. Those are the kind of things that you want to kind of say, okay, should I probably talk to somebody, either a psychologist or a counselor or a psychiatrist? But where, I mean, a simple metric would be that either it is interfering with your functioning, either physical functioning or your activities of day to day living, or if it is causing distress to the point where you're not able to bear with the distress. We are all able to live with certain amount of distress. It's some distress which just goes out of control, and when you reach that point where your distress is now out of control, you can't do anything but think of that thing all day. Then maybe that's when you need to actually say, okay, I'm going to go and talk to someone. Like, I mean, what we found in our work in rural areas is that it's the metaphor that they understand, or the word that they understand, is stress and tensions. You say stress and tensions of daily living, then they understand that. uh,
Okay.
that is something that is easily understood by the average person.
Okay, so I have a few more questions. One is, do you think that, and these are sort of, I guess, two linked questions. In the last, I think 2.5 decades maybe that you've been practicing, right?
Yeah.
2.5 decades. One is, are you seeing? I think I know the answer to this, but bear with me. Are you seeing more interest in mental health and mental illness from the mainstream as well? And the second part of this question is, are you seeing more people talking about things like anxiety? So actually, disclaimer is the title of our book is Age of Anxiety, something I was making fun of for the
Right.
longest time. But it is catchy. And,
Yeah,
do
yeah,
you
yeah.
think that we're sort of living in this age of anxiety? Is that because we're talking about it more, or we're actually genuinely more stressed, or there is more tension? Maybe we should call it age of tension, given your what you
Yeah,
just told
yeah.
us. But is it
Yes.
that we're feeling it more, we're talking about it more, or is it actually an increase? Do you think?
Well, I think first of all, let's split that sentence into many parts. The first is who is the we. I think the we in this context very often tends to be a certain urbanized section of our society. It's and even that urbanized section is probably, if I were to use very narrow terms like the upper class, upper socio-economic classes, or the middle classes. I don't think you see a lot of that. The woman who comes to cook at my place, or our maid, probably does not think about anxiety as such. That's really not her concern. So I think that it is a concern for a certain set of people. If you go to rural areas, then they do have anxiety and tension, but they are not concerned primarily about the anxiety and tension. They are primarily concerned about the reasons for that anxiety and tension. So the concerns will be around things like, my crops are not doing well this year, for example, or I have a financial difficulty, or there's domestic abuse in the house, and I'm worried about the fact that they don't articulate it as an anxiety, they articulate it as the reason why they are feeling like that. So I think it's a question of who articulates it in which way. And I think the age of anxiety, as you said, is articulated largely by a certain urbanized section of our society, not everybody. Thing is, are we seeing more of it? Was your question? Are we seeing more of it? I think, if I can take you back to the Maslow kind of hierarchy. I don't know if you heard about this gentleman called Abraham Maslow. Almost everyone has. There's a hierarchy of needs.
Yeah.
And as your needs at the lower level get satisfied, you start worrying about a higher level of needs. And and that the peak level of that pyramid that Maslow talks about are things like self-actualization and all. So you don't get to that peak of self-actualization till you satisfied your lower level needs. And so I think what has happened is that you can almost say that depending on where people are on that Maslow's hierarchy of needs, that's where they would be. So, your primary needs very often are food, shelter, clothing. Well, even before food, shelter, clothing is just survival. So, you want to ensure you just survive, you don't die. And then there's food, shelter, clothing, and then there's about some other things. And then probably you come to things like anxiety and depression, and then you might go to worrying about the world, and then you worry about yourself and self-actualization and the meaning of life. So I think what happens is you see anxiety. So you'll see anxiety is on that hierarchy of needs, and as populations move up on that hierarchy of needs, you'll see more and more of certain things happening. So if all your lower level needs are met, you then worry about the higher level of need. And that's how it goes. So I think it's an indication. So it's not a question of are we seeing more of it or are we seeing less of it. I think the question is, if you're seeing more of it in a certain group, then clearly their lower level needs have been met, so they're now worrying about this. And if you're not seeing a lot of it in some other groups, then their lower level needs have not yet been met, so they're not worrying about it.
So during this pandemic, beyond anxiety, and I think you've clarified very clearly, like what's the layperson's understanding, what's an actual disorder,
Yeah.
and also the Maslow's hierarchy. What are some of the critical concerns you're seeing? And you've been very outspoken on a few of them. You've also said we need to stop looking at some of these as individual concerns. That there's a much wider social
Yeah.
collective.
Well, I think that's yeah, that's my point. I think a pandemic is a good example of something that, irrespective of your coping strategies, you're going to get swamped with. Okay, So you might be very good at coping with things, you might deal with many issues, but a pandemic is like a wave which just washes over you, however good your skills might be. It's a bit like when you have a flood. However strong your building might be and everything you've done, a flood will probably bring down the best of buildings around it. Uh, and so a pandemic in that sense is increasingly that kind of a thing. It's an environmental event which swarms all individual differences. And so that has been the reason why I've been saying that we should stop looking at individuals and looking at the social, looking at the environmental or social factors, because this is such a huge event that it completely swarms over everything. And I think that's really what we should be doing, because I think it's such a thing that even people with good coping skills, with a lot of resilience, with lots of support, are still going to get swarmed over, with this pandemic. So it seems to me that focusing on individuals then seems like it's a bit like saying, oh, this building was built better because it withstood the flood and the other one didn't. But like a flood is a flood, it just going to swamp everyone. It's like I hate to use that word, but it's like a tsunami, like a wave which just washes all over you. How strong you are or not almost becomes irrelevant kind of a thing.
So then, what is if we had to try and sum up, and I suppose I should, the caveat being we were just talking also about there are so many new players. There's no certification in this process, but
Yes.
people are vulnerable and feel that they might need to reach out. How do you advise for the individual, right? Like, who do we reach out to if we're concerned? Because I think what's happening now is, I mean, we're seeing, of course, like AI assisted. And not everyone is following you on Twitter. They should be, to get your opinions on these things. But you're seeing so many, some well-intentioned and probably many well-intentioned potential interventions. But how do we know where to go, who to talk to, and where
Well,
to get?
I think okay. I'll give everyone the benefit of doubt. I think potentially most people who are doing something to help other people are well intentioned. Now, unfortunately, the road to hell is paved with good intentions, so that doesn't necessarily translate into good outcomes for anybody. But the fact is that nobody's questioning a lot of people's intentions. So, having put that aside, I think what we should be doing is thinking of a hierarchy of solutions. Just like you think of a hierarchy of needs, it's a good idea to think of hierarchy of solutions. And what's the lowest base level in that hierarchy? I think the base level in that hierarchy is offering, giving people a lot of skills for self care. I think self care is probably the best thing. So, what can I do to help myself? And that's probably at the base of a pyramid. It's the cheapest, and if you thought of a pyramid in terms of availability and cost, then self-care is at the bottom of it. It's the cheapest, it doesn't cost a lot, and it's also something that is easily available because all of us can do self-care. And so there are lots of simple self-care things that the government should actually be promoting and putting it out, which they have been doing, but not in a systematic sort of manner. So I think we should really, really focus our attention on promoting self-care, because that's probably the best thing we can do for large numbers of people, given our population. If you can build up people's self-care, and anyone who's, imagine if you had like a filtering system, the self-care acts as one lowest level of filter, which probably takes care of the largest chunk of people, and then people who get through that filter because self-care is not working, they need something more, then probably informal level of care, as we call it. Informal counselors, informal people who they're not trained formally in any psychological interventions, but there's somebody like you, for example, who has an interest, who likes to help people, who might undergo a week long or 2 week long training just to understand some basics, and is then able to talk and help other people. And that's again a huge number of people you can recruit into that informal caring, and then that acts as another filter. And then you have another filter beyond that, which is what are kind of semi-formal services. So the semi-formal services would be things like helplines. You can call up a helpline. Your informal network might be your friends and family, but if it's not working there, then maybe you call a helpline, and that's the next level of filter. And then people who can't be helped beyond that level of filter, who kind of, well, the helpline you tried calling and it's not helping and you need something more, can probably get help from professional services. And the professional services could be trained psychologists, counselors, and even psychiatrists. So I would see this as a kind of graded approach rather than to say everybody should go to the psychiatrist or to the counselor, because it first is everybody doesn't need it, and secondly what happens is you'll just swarm the system, and then you'll swarm the system with the ones who are the most demanding, not necessarily the ones who are the most needy. Because the ones who will, when you swamp a system and there's too many people and too little resources, then how do you triage? The only triage that ends up happening is the ones who shout the loudest get the most of it. But that does not equate to people. They are the ones who are the most needy. In fact, sometimes the most needy stand in the back of the queue quietly because they don't even know how to get help. So I think what we should be promoting is this kind of a very what clinicians tend to refer to as a stepped care approach, kind of. You do that with physical health also. Like if you got a cough and cold, you don't rush off to see the chest physician. You get a cough and cold, you're probably going to try some grandmother's remedies at home. You know what works for you generally when you get a cough and cold, and you'll probably do that. And if that doesn't work, after 4 or 5 days, you might get a little concerned. You might ask a few friends around saying, listen, that cough is not going off. What should I do? And then somebody will suggest 2 or 3 more other remedies, which you will try for a few more days. And then if it still doesn't go, you might probably go and visit your GP or something and say, listen, I've got this cough which is not going. Why don't you give me something? And the GP might give you something to take for a week or 10 days. And if it still didn't get better and you go back to the GP and say, look, it's not getting better, maybe at that time the GP will say, let's do some x rays or let's do some tests or something like that. And then if that still doesn't get better, they might finally say to you, listen, we've done everything, we've gone through these steps, maybe you need to go and see a chest physician. So there's a kind of graded process through which you've got, and not every person with a cough ended up at the chest physician. And the same logic needs to be applied to mental health issues. You don't want everyone ending up with a cough to kind of end up at a chest physician. You don't want everyone with any level of anxiety ending up at a psychologist or a psychiatrist.
Okay, cool. That's really helpful. I hope you can help to put that in practice with all of your.
Well, we are trying to. We are trying to. So, for example, in Gujarat, where we are running Atmiyata, our program has been running. So, what we did during the pandemic time was, and what Atmiyata really is it sits at that informal care, slightly informal and helpline level of care. But it also encourages a lot of self care. So, they teach people self care also. So, it works at that level. And what we did with a lot of with all our Akyata champions was to give them some additional training on specifically what are the issues that come up with the pandemic and how they can help people with those issues. And so they are there in their village. And most of our champions say, oh, they are now getting 2 or 3 calls in a week from people within the village asking for help or do some, can you help us with X, Y, Z. So clearly, a lot of that works. And then if that doesn't work, they know how to link people to the health system. So then they say, look, I can help you. Go to the PHC. There's a doctor there who can help you, who's been trained. And so they link people into the healthcare system. So we are actually doing that in practice. So it
Yeah.
is that is happening,
So that
and it
is,
is quite feasible.
is that going to be is that a pilot? Atmiyat is a pilot, right?
No,
Project.
Akmita is now not a pilot at all. It's running been running for last 3-4 years now, and it's we cover around 550 odd villages, and we have close to 700 such champions who are present. So almost every village has at least one champion, and most of these villages will have a population of 2,000, 3,000, that kind. So we cover close to 1 million people.
That's
Uh,
amazing, and that's in Gujarat.
Yeah, that's in Mehsana, in the district of Mehsana in Gujarat. We are also trying to expand it. So there's a small pilot which we've started along with a government agency. I don't know if you heard of this corporation called Mavim. Mavim is Mahila Arthik Vikas Mahamandal. It's a Maharashtra government corporation which basically sets up women's self-help groups in villages. So they are present in close to around 12,000 villages in Maharashtra, and they have close to around 100,000. Yeah, they support around 100,000 self-help groups of women. So we are doing a small pilot with them in 100 villages to see if we could train their people to be
Yeah.
able to do what our champions do, so that we run the system through their network, because they have such a widespread network. So
That's
in a
incredible.
sense,
Yeah.
yeah, in a sense, piggyback our intervention onto their existing network, and
Yeah.
using a kind of social franchising model. So we would still do the training, we would set quality control, do all of that, but they actually implement it. They run it, but we can assure that they will still do it at a certain level by providing that quality assurance.
Yeah.
So that's a pilot we are trying to run in Maharashtra now, and we are hoping to spread in other states. There is a lot of interest, and there is, people are also willing to put money. So we are trying to raise more money to spread in other villages.
Okay.
Um, so yeah,
That's
that's what we are.
that's gonna be that's actually really incredible. I need to read up more about these. We'll see where we can share more.